What was your most memorable experience while you were president of the ASDS?
It was an exciting time because during that time, we were first confronted in the aesthetic world with the battle of non-injectors. And I took it on as one of my goals was to really promote the fact that physicians should be the one doing aesthetic injections. We're the ones trained, and actually we're the ones who they sell the product to. I went before the FDA. We gave our pitch. We had a promotion campaign that said, look who's behind the needle. And I continued to promote that during our time. And hopefully we set an alliance with other specialties, facial plastic surgery, oculoplastics, to do the same thing as far as working together to promote the fact that we're the doctors, we developed these techniques, and we're the ones who should use it. You know, one other thing that I did start is before my time, there really were not small hands-on workshops to teach our members both injections, cosmetics, and also surgery. So I started the first small injection workshops that we had, and since then it expanded greatly. There's actually 4 or 5 every year, but it goes beyond the lecture hall, beyond our 1-year meeting, and involves our membership so much more.
What were the most pressing issues at that time that faced the society?
Well, there were a couple of them. One, we were involved in rivalries with other specialties. You know, specialties at that time, it was with plastic surgery, and some of the others who really didn't consider ourselves surgeons. And the battle we had was really to prove our identity, that we're the innovators, we're the developers. We do have a sense of surgery for the skin that goes well beyond what others who aren't first dermatologists and then surgeons have. So again, part of it was a PR campaign. Another part of it was getting our faculty and people in the society to speak at these other meetings and share what we have. And at that point, they started to share with us. So the mutual camaraderie between societies, I've always felt is a very important thing. I'm one of the few who has privileges in an operating room where I do a lot of my surgery because that's where surgeons at that time expected you to be. It's not today, but again, it's proof of being, doing it where you're expected to be a surgeon. These battles were fierce in those days, but today, I think we paved the way for it's so much easier for a dermatologic surgeon to walk in and be accepted.
What were the most significant innovations that were going on within the dermatologic surgery?
I can remember the beginnings of fillers and the use of them properly, and we were involved with both companies and with our own creativity on how to change aesthetics beyond surgery. And probably that was one of the biggest innovations. Also, the innovation of the use of Botox was beginning at that time, and I was involved in many of the trials. I was involved in chemical peeling and developed a medium depth chemical peel. It's called the Jesner TCA peel. People around the world now call it the Monheit peel because it is a very useful, very safe peel, not as aggressive as the deeper peels, but really took over. Then for a while, lasers overshadowed it, but it's back again as one of the major ways of resurfacing the face. And I'm very proud of that fact that our society has developed and continued to promote that peel.
And in your career, do you have a most memorable patient that you can think of?
My practice is 50% cancer and 50% aesthetics. And my cancer patients are always very grateful for what we do. But I should say one of my most memorable ones was a 18-year-old young girl who had acne scars on her face, so embarrassed, so downtrodden that she had her hair over her face like a Dachshund dog, covering everything except her eyes, didn't look you in the face, and wanted her face changed. I did a dermabrasion on her, and amazingly, she changed into a different person. She cut her hair. She opened her eyes. She had a glimmer and gleam to her. She developed self-confidence. And from being one who didn't know she was going to go to college, she became an electrical engineer, married, 4 kids, still sends me Christmas cards and grateful that I changed her life. So I learned even then early on that we're just not externally adding something to the aesthetics. We're dealing with people's ego, with their self-worth, and that's where the big change comes.
If you look back on your career, would there be anything that you would change?
I have to say, I really don't think I would do much differently. Even before ASDS, I had an association with the American Society of Facial Plastic Surgery, and my first mentor was a facial plastic surgeon named Galen McCullough. And Galen later became one of the founders of their society, the presidents. And one thing he said to me that I've always felt is very important is he said, we stand on the shoulders of giants. It's our obligation as we continue to educate to nurture those and put them on our shoulders so they will rise above us. And he did that. I brought that into ASDS. I'm very happy with what my career has been and where I've been.
And what advice would you give today's young dermatologic surgeons?
First, get as much education as you can. We're all eager to jump in and do the procedure, but understand what it is before you set yourself up to doing it. You're in a golden era of change and absorb every bit you can. And once you've developed those confidences, then you can start giving back to others.
Do you have any predictions for the future of the ASDS?
You know, we are very broad-based, and we have Mohs surgeons, dermatologic surgeons, aesthetic physicians, aesthetic surgeons, uh, all living together in one group. I think our most important future is to maintain all of these smaller subunits together so that it will continue to evolve into new units and new ideas, new techniques, and new specialties.
So what advice do you have for the ASDS leadership in serving its membership in the future?
Our major goal is education, but our also major goal is bringing an outreach of our specialty to the full community of people who want our services and also to other specialties. I think it's so important that our leadership maintain close relationships now with plastic surgery, facial plastic surgery, oculoplastics, the other specialties who do what we do, so that we can take what we learn from them to do it better and teach, and they can do it from us. When I started, it was an impossibility. And I think the inroads that we've made allowed all of us to be receptive, to support each other. And I think most importantly, our leadership should maintain these ties, continue to invite them to our meetings, and be at their meetings as well. I've had 30 years of a dermatologic surgery fellowship, and my last fellow was this year. And they gave me a beautiful book of quotations from all 30 of them. A number of them have fellowships of their own. They're all members of ASDS, and they all give. And my last fellow gave me this, which is my own little bobblehead, which I cherish. And they say I'm Dr. Sunshine, and I'll always keep that going, and the bobblehead will be with me.